hello, everyone. This is Dr. Amigues, your friendly rheumatologist and host of the Unabridged MD podcast. Thank you so much for tuning in to yet another episode. Today, I am so grateful to have Dr. Lodi with us. And you're going to see she is an intimacy coach in addition to being an OBGYN. She's going to introduce herself. I like to do that. But we are going to talk vulnerability. We're going to talk intimacy. I think I'm going to have you talk and introduce yourself, Dr. Lodi, and then I want to share why this is so important, even coming from a rheumatology practice. So thank you so much for being here.
Yes, thank you, Dr. Amigues. I'm so grateful to be on your podcast. Thank you so much. And so my name is Dr. Sadaf Lodhi, and I am a board-certified OBGYN. I'm also a sexual medicine fellow through the International Society for the Study of Women's Sexual Health. I'm also a Menopause Society certified practitioner, as well as an intimacy coach. So I do all of that. And my goal is to empower and educate women. And it's also to help women overcome any mental or physical boundaries so that they can experience pleasure in their relationship.
I love it. Thank you so much. And so that's like the first time we have intimacy talk on the podcast. I'm thinking like, wow, it took more than 2 years to talk about this. I'm going to share a story. Actually, it's not even one. It could be like many. But recently, I had a patient that's early 50s who basically told me that she was not sexually active anymore because it just didn't work. And I felt something break inside of me because maybe it's because I'm French. I do not know. Maybe it's just because I'm a woman and, you know, I'm getting closer to the 50s, not yet, but, you know, it's getting there. Or maybe just because I felt so sad that someone would just say, it doesn't work. So then I'm not even going there. And to realize that no other doctors had asked that question. And as the rheumatologist, I think I was just asking this question because, you know, we ask for dry eyes, dry mouth, dry vagina as part of the Sjogren, which is an autoimmune disorder that causes dry gland issues. But I was just like, wow, like what's happening that patients who are just 50s are giving up on this part of themselves when really it is so important that it probably has driven many wars before. You know, like, what's your take on this?
Yes, and I'm so glad you bring this up. Gosh, you know what? This is so common, and so many women say this to me, and I'm so glad that you, being a rheumatologist, that you were so insightful about asking about, you know, all of these dry areas and, you know, vaginal dryness, because so many physicians feel so uncomfortable discussing sexual health with their patients that they don't even ask. So I applaud you for asking, because this is such an important part of a person's life. And I would say that, you know, sexual health is a part of a person's overall health. And it's so important that we as physicians feel comfortable. And if we don't, then we refer to somebody who is comfortable talking about these topics, right? And I will say that a lot of women, I mean, I can't tell you how many women that come to the clinic and see me will say the same thing. They will say, you know, once menopause hits, and in fact, I have a little saying that says, you know, abstinence in menopause is a choice, you know, because it really is a choice. It's not something that has to happen, but it's something that, you know, if a woman decides that's what she wants, then that's fine, but it's not something that has to happen. And so many women will say that, oh, I don't use that part of my body anymore, or oh, wow, you know, I haven't had sexual intercourse for years or, you know, decades or whatever. And again, if that's something that, you know, is not part of their life or is not important to them, then, you know, that's totally fine. But if that was something that was a big part of their life, and then all of a sudden, just, you know, because of perimenopause or menopause, they've decided that it's too uncomfortable, and I haven't been able to find a provider that can help me with this or treat me, then I'm just going to give up that part of my life. And like you said, it's so disheartening and really upsetting, because something as simple as vaginal estrogen can really just be the answer to their prayer. Like vaginal estrogen is so important. And I was just on another podcast over the weekend talking about the benefits of vaginal estrogen, how it increases blood supply, it increases lubrication, it decreases urinary tract infections, it helps with painful intercourse. I mean, it does all of this, and it makes the pH normal again, and it helps with overactive bladder. It helps with so many things that it really behooves us as physicians, even if we don't feel comfortable prescribing, systemic estrogen for perimenopausal symptoms, menopause, that we at least prescribe vaginal estrogen, because it's not systemic. It doesn't go throughout the whole body, and it helps with so much, and really so little of it does so many wonders that I mean, if I could just talk about vaginal estrogen all day, I would, because it's just really a miracle drug.
It's really funny. I think I've never heard of so many people talking about vaginal estrogen than recently in the last 2 years. I love it. And, so I cannot, while you're talking about this and you're very comfortable talking about this, what I'm wondering is, why is it that women would think that it's okay to consider that this part of their life is over because they have gone through menopause, right? Like, so you're going through menopause, you're already, even if you didn't want to have kids, you're already going through this motion of like, even if I wanted to have kids, I cannot have kids anymore. And I think that from maybe the grandma or the great grandma used, like, right, like it was closer to the time where they were going away, right? Like, and they're deaf, but that's not the case anymore. Like, when you hit 50, you have another 50 years in front of you. Why do you think that it's almost like normalized to not talk about sexual health and to not talk about that? Why is it that women do not share their issues?
Yeah, because you know what, there's so many things. I mean, gosh, that's such a loaded question, right? Because one, it's society, right? Sexual health, even though we see it all over the TV and media and magazines and Cosmo and all this stuff, right? Always talking about the next best sex position. Still, when you talk about it with your friends, there might be a lot of taboo, right? Also, you go to your physician, and your physician, when you're talking to them about sexual health, they feel uncomfortable. So if they're going to feel uncomfortable, then the patient is definitely just going to retract and not even say anything, because they're like, well, my doctor feels uncomfortable, so I can't even talk to them about it. And then really it goes back to, gosh, I mean, I could talk about this forever. It goes back to, sex ed for us. Where do we learn that, right? And sex ed is really, for children, is really based on your zip code, because depending on who is in charge of the Board of Education of your district, they're the ones that are going to decide what you learn for sex ed. And some sex ed only focuses on abstinence and, pathology, and not to get sexually transmitted infections. And, if you're lucky, maybe they'll talk about intimate partner violence, but a lot of times it's based on abstinence. And so the kids aren't even learning about, pleasure. They're not learning about consent. They're not learning about, what feels good and what doesn't feel good, right? So it all starts from that. Then we go, as physicians, we go to medical school. I don't know about you, but me, when I was in medical school, I learned probably 2 hours at most, right? Masters and Johnson, the linear model of sexual response back in the 60s, they did research, and what they learned was based on, white men, and then they applied that to everyone, and they didn't even talk about the female sexual response cycle, which we know is totally different and came about in 2001 with Rosemary Basson out in British Columbia, and she came up with the female sexual response, which is actually circular and is not a linear model. So, we are really so far behind with talking about women's health, funding women's health and research in women's health, and let alone forget sexual health, right? Not even like regular health. So I think that all of that attributes to why physicians don't feel comfortable talking about sexual health, why patients don't feel comfortable talking about sexual health, and why they think that once you hit menopause, it's over, it's done. And like you said, our parents didn't know, their doctors didn't know about vaginal estrogen, so they were never treated. And so our parents didn't know, and then they weren't treated. And then it just keeps going on and on through generations, because if nobody talks about it, then, you're going to think it's wrong, shameful, dirty, and you're not going to talk about it. Two, if your doctors don't know how to treat it, then you're never going to get treated. And you're just going to think that that's just a normal aging process. And that's just the way it works. And, I'm not going to be able to get any help.
Yeah, wow, so much here, so much that I want to unpack. The number one is I don't think I even had a sex ed education in medical school back in France. So we're talking France here. I did remember a little bit of sex ed in biology class when I was a teenager. Yeah, it's really funny that most of our education comes from peers.
Yes.
And so that's not the greatest.
Exactly, 100%. That's why. And some of it's misinformation, right? And some of it's from the media.
Yeah, exactly. And so, okay, so you were talking, so this is interesting. I live in Colorado, and there's a lot of talking about, how do you call this? Sex positivity.
Yes.
I think that's the word, yeah. And, it's really interesting. I'm raised Catholic, and I know you're talking about religion, right? Why is it that, why is it that it's so ingrained in us that even later on you're like, yeah, sex positivity. But then you're like, well, the little voice in my head, oh my gosh, I can't talk about this. And I would tell you that being a physician allows me to be so much more open. Yes. I think I would be in a much worse place.
Yes.
But I wonder, like, what do you think? What's that? Like, where is that coming from?
Yes. Well, because these are all the messages we hear, right? Like, so, we were looking at where do most people get their ideas about sex, right? And it's mostly through culture, it's through religion, it's through friends and all of that, right? That your exposure to your community of whatever it is. So if we're raised in a sex negative environment, say that you're part of a community or a culture or religion that thinks that sex is wrong, shameful, dirty, and that it's only for procreation, then those are the ideas that are going to be ingrained in your head. So even when, you're trying to go to a sex positive mindset, you're holding yourself back. Right? Because all those thoughts keep coming back to your head and you're like, oh my gosh, am I doing something wrong? Is this wrong? Is this sinful? And even if you have gone past that, still there's some part of you that may still be thinking that, right? So the question then becomes, how do we go from sex negativity to a place that's sex neutral, even if it's not sex positive, right? And the way that we start to do that is by changing our thoughts. It's interesting because as a coach, I work with a lot of women that have grown up with sex negativity, right? And so that's why they find it so hard to be intimate in their relationship, because those thoughts keep coming back. So what we really realize is that how do we move forward from that place of sex negativity to sex positivity? Well, you start with your thoughts. And that's a lot of times what I use for patients for sex coaching or, clients that I have. And you start from a place where, you realize that you have control over your thoughts, which is totally something that's revolutionary almost, right? Because we think that our thoughts come and we have no control over them and they just take over. And we don't even know that, the thoughts that are coming, whether or not they're good or bad, may be causing us to have a certain type of feeling, which causes us to have a certain action, right? But if we're able to change our thought, and again, it doesn't have to go to like a complete sex positive, but even just to a place that's neutral, right? Then we can control our feelings that we have. So instead of the feeling that we have when we have sex negativity, which is that perhaps sex is wrong and shameful and dirty, then the action that I would have is perhaps I wouldn't engage with my partner or, whoever, and not feel comfortable while being intimate with them. As opposed to if I'm at a sex neutral spot or sex positivity, right, then I'm more open to having more of like an open feeling, like sex is a normal part of life. Sex is good. Sex helps to encourage, a relationship and a more emotional connection with my partner. Then my action is going to be that I'm going to be more receptive to like a sexual stimuli, right? Whether it's my partner giving me a hug or a kiss or trying to be intimate, I'm going to be more receptive if my thoughts are more either neutral or positive as opposed to negative.
That is so useful. So I'm sorry, there's like so many questions I have here. I wonder, like, so my first question is, do you think it's a generational thing? Because I don't know if it's because I rock climb, but I hang out with people who are like 10 years, 15 years younger, and I will tell you, like, they have no problem. So, but at the same time, my cohort is like, my sample size and my sample is from Colorado, which I think is pretty open. Do you think it's a generational thing? Do you think it's a religion thing? Like, where, do you see that it's going to just get better with time?
So I think the change happens with us, right? And I think that, yes, I think that it is generational. I think that perhaps our parents were definitely more very shy about talking about something like this. And I think that, as we get older, I think we tend to be a lot more open, but I think it really just varies. And again, like I said, I think the change starts with us. So if we can change, even if we grew up with sex negativity, if we can change to more sex neutral, sex positive, then if we have children, then we can, share that information, that sex positivity with them, so that then they become more sex positive, and then it continues, right? But if we don't have those conversations that are open and vulnerable with our children, then they're not going to feel comfortable. And then they're going to, again, have those same thoughts that, well, I can't talk to my parent or my caretaker, whoever's taking care of me, because they don't feel comfortable. And so there must be something wrong with this topic. And so I'm never going to open up to them, because, either they're going to shame me, or maybe they'll get mad at me, or maybe they'll think that, how could I talk to them about this? And so if we're shutting down that conversation with, say, our children, then they're never going to feel open, and they may end up growing up with sex negativity as well. And so then, and then it'll keep going on and on. But if we can change, then I have hope that, it'll change as we get older. And, like I said, we have images throughout, right? Like here, especially in the West, there are images of sex all over the place, right? You don't have to look very hard to find those images. But it's funny, because one-on-one, those conversations may not be as open.
Mm-hmm. Yeah, it's really interesting. It's almost, I was wondering about this. We keep seeing sexual content everywhere. Yet, I think when you go into the rooms of patients, like, and I think, as a physician, we have a really powerful relationship with our patients, right?
Yeah.
Where we get to learn about this, which, I do think is health, so very important. But it's a stark contrast with what we see outside, right? Like talks, maybe, advertisements, maybe, and then you talk one-on-one, and then you realize that there's a lot of shame and a lot of, oh, anyway, like it doesn't work, and that's okay.
Yeah. There's a lot of that purity culture, right? And I think that comes from perhaps our communities, or the messages that we see and we hear. And I think that is something that we all, that a lot of people are exposed to, right? So they have to, and that can lead to that sex negativity that we have, or maybe that we've grown up with. And so we have to work through that. And a lot of times I find that, either working with a sex coach, or working with even a sex therapist, especially for patients that have had trauma and abuse in the past, right? Helping to unpack all of that, so that they can move from a place of sex negativity to even just sex neutrality, so that they're open and receptive to love and being intimate with their partner without kind of cringing inside, or without, dreading it, or saying like, gosh, I hate this part of my relationship, but I don't know how to move forward.
Mm-hmm. That's so helpful. I think I can see many of my patients needing this, and I don't even go into a lot of details, because of course that's not really the primary reason they see me. Dr. Lodi, I could really like grill you on so many questions, but I want to be respectful of your time. Where can we find you? Where can we work with you? How do we do that?
Well, thank you so much for the opportunity. So yes, so I am on Instagram and TikTok at Dr. Sadaf OBGYN. You can set up a telehealth appointment with me if you're in New York and Michigan for sexual health and menopausal health. If you are an intimacy coaching client, I can work with you anywhere. And so again, you would just go to my website, which is drsadaf.com, and schedule an appointment there. I also have a podcast called the Muslim Sex Podcast, which hopefully Lodhi. Dr. Amigues will also be on there with me. And then I'm actually hosting a retreat in September 16th through the 23rd in Morocco. So we're going to be focusing on sexual health, menopausal health, and also on nutrition. So that's going to be really exciting, and I'm super excited about that. But yeah, so those are all the ways, and I'd love for people to reach out. I'm more than happy to work with you if you're interested in intimacy coaching.
Wonderful. Well, thank you so much. We'll have all of this in the show notes. Until then, thank you so much. Everyone, if you found this episode useful, which personally I did, share it. There is someone in your life that needs to hear this. There might be women, there might be men, but I think there is hope on the horizon for sexual health. And I think it's time to regain power as women and as men, really, but like really more as women towards this aspect of our life. Until then, see you next week. Bye-bye, everyone.
Bye.